So thank you for coming today. So Murrumbidgee announced two cases over from yesterday's data, one case in Albury and one case in Edward River LGA. The Edward River LGA is linked to a household contact of a positive case already, and the Albury case is new, and we're investigating its source and potential exposure sites with that. Overnight, after the data closed as well, we are aware of 4 more cases who have been in the Albury and Hume region. There's been some Albury exposures with those, and so we're just working through that with the cases and the notifications to interview them all and work out where the exposure venues are. We have identified the Z Bar as an exposure location. So anyone who was at the Z Bar on Friday the 8th between 5:30 and 11:15 p.m, they will be classed automatically as a casual contact, and we ask that people get tested and isolate until they get that result back. However, we may find on further investigation that some of those people at that venue are close contacts as well. So we were just working through that with the case and the venue to confirm whether we need to put a higher isolation on anyone who may be in the event at that time.
What do we know about this case that attended the Z Bar and where they contracted COVID?
Look, we don't know a lot. We don't know the source of that person, and so, as I said, further investigations are coming on. It looks like we actually have two people that had been to that venue. One of the other persons in our notifications are there. However, that may have been a source at that time. So we're for that second case. So we're just still working through that and trying to piece it together. It only came through, as I said, last night and this morning. So it does take some time to work through that. I think it's timely to to remind people. The virus is in Albury. It's in Wodonga. It's in our local region. Please, if you have any symptoms at all, get tested. That was what prompted our first case to get tested, because she was symptomatic and had not identified that she'd been in contact with a known case. So it is, it's up to you guys, to the public, to recognise that you've got some sort of symptoms and get tested. There are lots of testing centres available. We've got in Albury the Showground and the Lavington Hall, and then there's sites in Wodonga as well to get tested at. So please don't hesitate. If you're not sure, don't put it off, get done straight away. And of course, if you're not vaccinated, now is a great time to get vaccinated. So there are lots of vaccines available through GPs, through chemists, as well as the public health system. So please find a convenient spot for you to get vaccinated and put your name down if you haven't already.
Are you able to tell us any information about the gender or ages of the people in Albury who've tested positive, or in Greater Hume?
Look, at this stage, I haven't got them listed, so I won't reveal that. But it is a range of ages, yeah.
And is it all in the one household? Are there Albury cases?
No, there's multiple households.
And just to clarify, so the contact who, a couple of questions actually about Z Bar. So there was one woman who was at Z Bar, had symptoms, got tested, and somebody else who was in contact with her then also subsequently got tested, and they're both in today's cases?
So last night's case was where identified exposure while infectious at the Z Bar, and this morning's case that we've got was at the Z Bar at that time, and has subsequently, looks like they've subsequently tested positive. Whether the sort of level of contact, we've not been able to establish at this point.
So to clarify, that means there's 4 total cases in Albury, 2 of those linked to Z Bar, is that correct?
Yes, but I will also say that one of those persons in Albury won't be in our data, because they actually don't live in Albury. However, they have been in Albury, so it's not going to be reflect in the data tomorrow.
Could you
Expecting more? Sorry.
No, you go.
Are you expecting more cases or more exposure sites?
Yeah, look, I think so. Yes, there will be more exposure sites announced. We just have to establish with certainty the times around those things. So at the moment we're accessing QR code data to confirm that. So there will be more sites of exposure, and we'll get those out to the public as soon as we can be reasonably certain that we've got them as accurate as possible. And look, in all honesty, there's probably going to be more cases as well. So please be vigilant, everyone, and get tested if you're suspicious.
Do we know how long everybody's been infectious in the community for before they tested of the cases announced today?
Well, the investigations are still ongoing. We do know that one case we've investigated so far has been infectious for 1 day in the community, and the one last night was also infectious for several days in the community as well. So we do have risks associated with that, of course.
Yeah.
At this stage, everyone at Z-Bar is deemed a casual contact. Do you know at what stage that may be upgraded to close contacts?
Look, it's again, it's an individual assessment of the risks. So we're trying to work through, because obviously it's a big venue and not everyone would have been in contact with that person. So it's a slow process to work through to see if we can identify who may have been in closer contact. So I can't tell you definitely there'll be more people, but it is likely that we will detect a few people that have had a closer interaction with this person.
I'm not sure if it's your jurisdiction or whether we should have asked this question of the police, but was Z-Bar, did they have all the right COVID safe protocols in place?
That's a police question, yeah.
No worries.
Yeah.
I was going to say something else, but I've forgotten it, sorry.
All right.
I do have more, I'm sorry.
Yeah, go for it. Yeah.
I just want to clarify too, the case that went to Z-Bar, are you thinking that they picked it up in Z-Bar or they caught it somewhere else and then went to Z-Bar?
No, they were infectious while they're at Z-Bar, so that they've picked it up somewhere else, and that we haven't determined where that source is at this point.
Okay, and it could be anywhere?
It could be anywhere.
Yeah.
Yeah. It may not have even been from our area as well. Yeah. So we are, or it may be someone from outside of our area who was here briefly and left too. Yeah. So there's lots of investigations to work on. It's complex to try and determine those sort of things, and we just work through as best we can.
And how is Mlhd going with the amount of contact traces? Like we're up to now 50 in the Mlhd, 50 cases. I mean, obviously they've all happened over time, but how is your staffing handling coping with hopefully not an increasing amount of cases?
So look, we've got some good staff on, and we've actually recently recruited to some more contact tracers support teams. So and they're being trained up at the moment. So at the moment we've got sufficient staff to cater for those numbers. Also with the systems are changing a little over the last this week with the new rules opening up and so forth from Sydney. Some of our protocols are changing as well, which will enable us to be a little bit more efficient with some of our contact tracing, and so that will free up some time as well for the existing staff.
And do we have any idea where the Greater Hume case contracted the virus?
Again, it's early days and we haven't quite made that link yet, so no, we don't know for sure.
So come back to you later.
Yeah.
Just trying to think if there's any more of questions that I have on this particular topic before I move on to the next topic, but I think I'll just move on to the next topic.
Okay.
The Oakman Hospital, there was an ABC story published that was saying that it was in crisis, 10 nurses refusing to get vaccinated, that sort of a thing. How is Mlhd? We said Mlhd was redeploying staff to go help there. How is the hospital going?
Look, the hospital is functioning. They have used either locum staff or redeployed staff to keep it functioning. So it's a perfectly safe hospital for people to go to. We did transfer out some patients in the early days while we furloughed staff, and we assessed where the risks were and what our capabilities were, but that hospital is functioning and it is fine.
And how concerned are you with that crisis, considering that there are a growing number of cases in the Edward River Shire as well? Yeah, look, it's just it is something we're prepared for. We're prepared for it in every hospital, in every district, every part of our district. So we do know that we'll be going to have people come in. What we do hope is that we'll be able to identify that they're positive before that they have transmission. We do have precautions. All our emergency department staff wear full PPE so that those walk-ins who haven't had an opportunity to be tested yet there's no risk to the staff, and we minimise how we put people in our facilities. We have zones as well within those facilities so that anyone that we believe might be symptomatic with COVID, we separate those immediately from everyone as well.
So there is precautions, and we do know that we're going to get that. So we're worried, but of course it is something that's going to be everyday life from here on in, and or it has been for some years or some months already. So it's just something we're prepared for. Yeah.
And is there any indication that the people who chose not to be vaccinated are going to change their mind or have been reconsidering?
Look, I don't know specifics, and I won't talk specifics. But to be a healthcare worker in Murrumbidgee Health and New South Wales Health, we do need to be vaccinated, and that is a requirement. So for people who choose or do not get vaccinated, they will be assessed as redeployed or leave the organisation.
And is there any services that are particularly changed or impacted since those staffing changes?
No, as I said, where those staff were or did leave, those replacement staff is put into there, so the services are still available.
Yeah. And was there anything else you wanted to say on that?
No.
That's too easy. Thank you.
Thank you. Look, I will also say something. There was a breast screen has reopened up again. So there was a question about that. So the breast screen services in Albury, Wagga and Griffith that closed down for a period of time when there was lockdown. That has reopened. For people who are booked and had their appointments cancelled during that time, please be patient. The breast screen staff are ringing everyone to make new appointments. So if you've had a booking cancelled, they'll be in contact with you soon to rebook your appointment. And of course, if anyone has specific concerns about their breast health, a lump or something, please make an appointment with your doctor to be assessed straight away.
Has that been an area where there's been a big drop-off in people coming forward because of everything that's been happening with COVID in general?
Well, obviously when the services stop,